Nursing theorist Virginia Henderson defined nursing as the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge. As Virginia Henderson stated, nursing involves providing individuals with the necessary resources and knowledge to self-manage their illness. Communication barriers between the nursing professional and the patient can affect patient outcomes. So in order to provide heart failure patients with exceptional care, nursing professionals should include communication strategies to decrease deficits in self-management. Self-management is vital to improve quality of life, prevent hospital admissions, and decrease healthcare costs. Heart failure has reached epidemic proportions with 5.8 million Americans affected. On March 23, 2010, the Affordable Care Act became law. One of the improvements defined in this law is linking payment of services rendered based on quality outcomes. The Centers for Medicare and Medicaid and the Joint Commission have also increased provider accountability by publishing quality results through websites such as hospitalcompare.com. With the increase in public awareness and the changes being made through healthcare reform, we as providers must also change our goals. We need to refocus how we provide care in order to increase the quality of care our patients are receiving. Heart failure is a chronic disease, and the Joint Commission has developed core measures. These measures include such things as medication. Is the patient on an ACE or an ARB? Was he provided the appropriate education, such as diet, smoking cessation, and the need for daily weights? There are also many resources available to the nursing professional to help guide their care of the heart failure patient. The American Heart Failure Association program, Get With the Guidelines, identifies the areas of importance and is a tool they use to evaluate the care a heart failure patient has received. These guidelines include things such as performance measures, which includes discharge instructions and educational material, quality measures such as with the chronic atrial fibrillation patient, discharge on an anticoagulant such as Coumadin. Washburn and Hornberger in 2008 stated it is critical that nurses have complete understanding of heart failure management guidelines developed by the ACC, the AHA, and the Heart Failure Society of America to ensure patients receive accurate information. The American Association of Heart Failure Nurses also developed a tool which they dubbed CASH, which reviews potential causes of heart failure, signs and symptoms, and assessment questions that we can use to identify the patient's needs and their knowledge base. Nurses use all types of communication in order to elicit relevant information to formulate an appropriate plan of care. A study conducted by Buree in 2007 showed that symmetrical communication is patient-centered, fits with time constraints, and best utilizes resources. This study also pointed out that nurse-patient communication can affect how a patient understands this information that's being provided, which could contribute to negative patient outcomes. Nurses need to develop their communication skills and knowledge base to gain insight into the individual's barriers to learning, the necessary skills to self-manage their disease. According to a study conducted by Dixon, Carter, and Regal in 2009, only 27% of patients thought that self-care was their primary responsibility, and 51% just said they do as they're told. There are many barriers to consider when educating our patients. According to a study in 2008 by Dunbar, Keogh, Pressler, Song, Moser, and Lenny, patient care can be further complicated by comorbidities such as diabetes, which can make their self-care regimen more complex, increases symptoms. It may decrease their functional status, which can ultimately lead to increase in hospitalizations or even death. Unfortunately, there are times individuals tend to misinterpret noncompliance without identifying the barriers that are inhibiting the patient's ability to provide self-care. According to a scientific statement that was published in 2009 by the American Heart Association, which identified a variety of barriers such as economics, illiteracy, and physical restrictions, and even a lack of family support. With the Affordable Health Care Act initiated and changes being implemented from this law, pressure has been placed on institutions and individual providers to incorporate tools such as Get With the Guidelines and court measures to ensure our patients are receiving quality care. Being knowledgeable of these tools and developing good communication skills will assist the nurses to tailor educational needs to each individual. This is vital to decrease healthcare costs, ensure reimbursement for services provided, and most importantly, it provides our patients with the ability and confidence to self-manage their disease. Are there any questions?
How can communication affect the information gathered during an initial assessment?
Well, how you ask the question sometimes can lead to more information. You don't want to ask a closed-ended question such as, do you live alone? It's more likely you're going to get a yes or a no. But if you ask if there's anybody that comes by that assists, you might learn that the daughter comes by in the morning and sets out the patient's pills. And you might want to then incorporate the daughter in the education process so she can reinforce the information to the patient when the patient's discharged. Any other questions?
How can I, as a nurse, change the way I view patients regarding compliance issues?
Well, you've got to keep an open mind. One thing I like to incorporate is I ask the patient what led to his hospitalization. And you might find out he can't afford his medication, and you might want to involve social workers.